While there are months dedicated to bringing awareness to different health concerns, it doesn't mean that you shouldn't be getting screened for them all year round. Early screening and detection is the easiest way of preventing illness or death. Health screenings can identify symptoms or warning signs of potential illnesses before they become serious. They can also help ensure that you receive the necessary medical treatment. Now, one of those screenings, the mammogram, doctors say women 40 and older should be getting one every single year to catch breast cancer early. In fact, I go for mine tomorrow. The National Cancer Institute says breast cancer is the most common type of cancer in the U.S., with more than 300,000 new cases last year. And 6,000 women are diagnosed with breast cancer in North Carolina every year.
Routine mammograms are critical for detecting breast cancer early, when it's easier to treat and chances of dying from the disease are lower. Now, a new CDC vital signs report shows 1 in 4 women ages 50 to 74 are not up to date with the breast cancer screening.
This is concerning because we know that about 40,000 women die a year from breast cancer, and having these screening mammograms can save lives. We found several reasons why women aren't getting their mammograms every 2 years.
Those reasons include the cost for access to care, lack of transportation, food insecurity, loss of work, and feeling socially isolated. The report found the more of those health-related social needs a woman is dealing with, the less likely she is to get a mammogram. CDC Chief Medical Officer Dr. Deborah Howery says these barriers need to be removed.
It's really important to address these needs now. When doctors are meeting with a patient, they can screen women for these needs and then connect them to community services. And if women are uninsured, CDC has a program in all 50 states through the health departments that will allow women to get a mammogram for free.
While death rates from breast cancer have decreased, they remain high for Black women and women with low incomes. Federal health officials are encouraging all women not to delay their mammogram. Michael George, CBS News, New York.
Now, more women under the age of 40 are also being diagnosed with breast cancer. Data from the American Cancer Society shows that between 2010 and 2019, diagnoses among people ages 30 to 39 increased by more than 19%. Experts say there are several possible reasons for the trend, like risk factors, including drinking and obesity, and an increase in genetic testing. Some younger women may hold off on sharing concerns about their breast health because of their age, but health officials are encouraging anyone with health concerns, regardless of their age, to contact their doctor. Now, much like in the case of breast cancer, we're seeing more colon cancer cases in younger people. Colorectal cancer is now the leading cause of cancer death in men under the age of 50 and second for women in that very same age group. According to the American Cancer Society, doctors say lowering the age to start screenings is what's needed. The American Cancer Society now says adults at average risk should start screening at 45. That is 5 years earlier than the previous recommendation. The disease is most treatable when found early. However, a big obstacle is just getting people educated about that screening.
Sometimes it can be misleading information, or thinking it's just hemorrhoids, this bleeding that I'm seeing, or I'll get to the doctor, but then you don't.
Colonoscopies not only detect the disease, but can also prevent the cancer by removing precancerous polyps found during that procedure. Now, there is a potential game changer in the fight against colon cancer. It's a promising study that's published in the New England Journal of Medicine, and it found a new blood test is able to detect 83% of colon cancer tumors.
I was a little disappointed that only about 2/3, 11 of 17 patients who had the stage 1, the very earliest, were picked up. Still, something is better than nothing. It still remains to be seen whether or not, how widely this is going to be used, how expensive is it going to be.
The FDA is considering whether to approve that blood test, but doctors say colonoscopies are still the best way to detect cancer at its earliest, most treatable stage. Well, the American Cancer Society has also updated its guidelines for lung cancer screenings. The new recommendations expand the age range from testing to between 50 to 80 years old. The American Cancer Society says about 238,000 new cases are discovered each year. And when it comes to deaths, that's about 127,000 people a year.
Most lung cancers are actually diagnosed asymptomatic, and that's why screening is so important.
You lay on your back, you put your arms over your head, you take a deep breath and hold it for 10 seconds. You're in and out of the scanner in 5 to 10 minutes. No dye, no injection, no IV. It is quick, it is easy, and it is very impactful.
It's now estimated that an additional 5 million Americans will now be eligible for regular scans, and about 21% more lives could be saved. Now, here's something that you need to watch out for. It's radon, a radioactive gas that comes from up underneath the soil and seeps into buildings. It's been linked to lung cancer and is the #1 leading cause of lung cancer in non-smokers. On average, 450 North Carolinians a year die from radon-induced lung cancer. The state recommends testing your indoor air every 2 years.
Radon, which is a colorless, odorless gas that could be present in any of our houses, also can go undetected. You should test your house for radon to make sure that you don't have high level of radon.
If found, experts say radon can be easy to remove from a home. Now, while many of us plan to spend time at the beach this summer or just in the sun in general, you need to keep in mind the importance of course, protecting your skin. Research shows sunburn damage the skin, and even one blistering burn during childhood can increase the risk of developing skin cancer later in life. A new survey by the American Academy of Dermatology reveals that more than 1/3 of adults got a sunburn last year. That same survey found that only 34% of Americans use sunscreen, with only 1/3 reapplying it every 2 hours, like the directions say. Now, even though skin cancer is the most common type of cancer, it is also one of the most preventable types.
Skin cancer at its earliest stages is very curable. Melanoma at its earliest stage has a 99% cure rate. The #1 thing to look for is something that is new or changing. So anything that is new or changing and it stays there for about 6 weeks should be examined by your dermatologist.
They say to remember the ABCDEs of melanoma: asymmetry, border, color, diameter, and evolving. All right, if you missed any of this information, we're going to have it on our website. WFMY News 2 at 6 is coming up next.